Hello and welcome back. So in this video, I'm actually going to be discussing the chemotherapy drugs that I have, kind of the things that were discussed to me during my chemo teaching. So my first drug was Adriamycin. Adriamycin is also nicknamed the Red Devil. This drug, y'all won't believe this, but I was just recording this video and the camera just went off on me. So I'm starting all over to record it again. But this drug is actually pushed to you during your IV, which is actually done through my porticap that's in my right arm. But it's giving via push, meaning the nurse actually pushes it through the IV that she has set up. And it's pushed over 10 to 20 minutes. Takes her about 10 minutes with mine. The side effects, the most common side effects of this medicine is nausea, vomiting, total hair loss. You can have possible red urine 24 to 48 hours after treatment. Mouth sores, you will have low blood cell counts and fatigue. And some of the less common side effects of this is irregular heartbeat, heart problems, swelling of feet and legs, and shortness of breath. The side effects that I've had with this medicine is nausea, no vomiting, thank God. I had diarrhea once. Total hair loss. I do not have any hair. I will be showing my hair in, maybe I'll show a picture in the next video. I'm not taking off my wig today. As a matter of fact, I might just start the next video without any hair. But I do walk out without the hair. But the other medicine that I have is Cytoxan. And Cytoxan has low blood counts again, nausea, vomiting, hair loss, irritation of the bladder, kidneys, diarrhea, mouth sores, and darkening of the skin. So remember, I was taking these two drugs for 8 weeks. And when you take the Adriamycin and the Cytoxan together, you come the same day, every 2 weeks for 4 cycles, which is 4 times. And then the very next day after I had the treatment done, so I would go for the actual chemotherapy drugs on Tuesday, and then back on Wednesday just to have a bag of fluid placed in my body, because what they discovered is that when you came back the next day with the bag of fluid, you would also, your body recovers a little bit better. So I came back for the next day of fluid. Also, on the days that I actually had treatment, I also have to get this drug that's actually called Neulasta. And Neulasta is actually placed on your body. It was placed on my stomach, and I'll insert a picture of what it looks like. It's placed on I placed it on my stomach. Some people chose to place it on the back of their arms, things like that. But I placed it on my stomach because I could see it. But it's placed on you, like it was placed on me on Tuesday around 3. And 27 hours later, usually between 6:30, it all depends on how my treatment was going. 27 hours after treatment, it would auto-inject on your body. And that Neulasta was responsible for making new white blood cells to boost your immune system, because when you're doing chemotherapy kills all the cells in your body. So good or bad, all of them are dead. So it's kind of like replacing the white blood cells so your body can make more white blood cells. I said that wrong. So your body can replenish those cells so that you're not, super sick or things like that. And then some of the things that happen with me with the Cytoxan and Adriamycin is, number one is, you may see, you may not, but my nails are really black. I insert a picture just to make sure you can see it. And my hands turn black on the inside as well. I'm going to compare it to my son's little hands and my hands so you can kind of like see the difference. My hands also turn dark. I didn't lose my my eyebrows thinned out, but I didn't lose them completely. I didn't lose my eyelashes. And if I haven't lost them now, I don't believe they're gonna go away. My hair I totally lost all my hair, which is only hair. Girl, back I wear wigs anyway sometimes, so it's all good. I had the worst heartburn, and I felt like I was pregnant. I still have it, but it's not as bad as it was. I couldn't eat, like anything I ate gave me heartburn, but I had to eat. You cannot take aspirin with this. I did have medicine to control the nausea, so I would take medicine mainly before I go to bed. And excuse me, as the treatment went on, it seemed like I was getting nauseous in the morning as well. So I would have to take another drug in the morning to control the nausea. But I never had to vomit, which I'm so grateful for. I did, like I mentioned, I had diarrhea one time, and she knew, my nurse knew that I had diarrhea because my potassium level was low. It's amazing how the body works. And those blood tests that they administer tells you all this stuff. And fatigue. I had fatigue really bad. I'm like always tired all the time. So tired. It's getting a little bit better. I have my shortness of breath is getting better. I had extreme bouts of shortness of breath. I mean, it would be so bad. Like if I walk up a hill today, and today I'm not even on this medicine anymore, but it's still a side effect of the medicine I'm still on. If I walk up a hill, I'm out of breath immediately. Like I was running, and I'm really not. But that is a side effect of the medicine. As a matter of fact, when I go back to the doctor, I think I'm going to tell them I need an echocardiogram just to take a look at my heart, because I didn't discover this until later. Well, that's one thing about being on these medicines. You end up researching and finding out more things than, because I found this actually in the breast cancer support group on Facebook. But this medicine can really, I didn't realize the extent that it could actually affect your heart. And that's one of the things the doctors don't talk to you about. So if you're going through cancer, know someone going through cancer, research everything. Because they're going to tell you one thing. If they tell you that, you write it down and you go home and you research it. That's what I'm going to tell you to do. Research everything. Do not trust you have to trust your doctor, but I trust them, but I also know that I have to go home and research everything. So that's why I'm gonna ask them to take a look at my heart, because I do have a bad case of shortness of breath, and I do not like it. Just last week, my back aches. My back aches so bad sometimes, and I have no idea why. It just aches. I mean, like in pain. Like I cannot believe how bad my back hurts. And my mom's like, well, you had back pain, prior to this. But I'm like, Mom, it's not the same. This is totally different. But I had an x-ray last week for the back pain, and it actually came out negative. So there's nothing there, but it could be just a side effect of the medicine, and the medicine still wearing off of my body slower. I haven't had the extreme that pain since last week, but it was like content is like every day my back hurts. Every day my back hurts. Every day I'm taking a leave because my back hurts. And sometimes I would take something stronger than that because it hurts so bad. But thank God the x-ray came back negative, and I praise him, because I don't want anything going on in my back. Believe me, and no one else does. All right, so back to the medicine. So I told you about I told you about the Adriamycin, the Cytoxan, and the Neulasta. And remember, I come back the next day for fluids, and then it's a 2-week waiting period, and then you go back in. You also have doctor's appointments. Once you actually see the doctor about once a month, unless you have to see them earlier. I have not had to see the doctor earlier. Some of the things also that I didn't tell you is that prior to when you're getting your chemotherapy drugs, you're also getting some pre-meds as well. You're given steroids. You're given 2 anti-nausea medicines so that you won't get sick while you're there. Herceptin is given to you. It's kind of like a blood thinner. My needle was, when I came home on Tuesdays, for my port, I actually kept my port inside, my needle inside, and it was covered up and wrapped up because I told you, if I haven't told you already, I hate my port being accessed. It's like kind of uncomfortable. So anyone who's going through chemotherapy, you know someone's going through chemotherapy, the trick is you actually put lidocaine on your port area, right? So you put lidocaine, you don't touch, and don't touch it with your fingers, use plastic. I use plastic wrap, but I put lidocaine on this area here, just some lidocaine here, and what I do is I rub it on the area, and then I would also put a piece of plastic on top. I put a dab of the lidocaine on the plastic, turn around, place it here until I get to my appointment, and I let my nurse remove it, because what it does is it numbs up this area really good. So when they're accessing that port, I only feel pressure from them accessing, placing the needle in, because for that, it's just something with me and needles, and that just having that port access, I just hate it. And I've made a big deal of it. They also, if you don't have lidocaine, your nurse could get your doctor prescribe you lidocaine from the pharmacy. I happen to have my lidocaine from when I thought I was going to have that needle biopsy from the breast surgery, and I didn't use it. And my health guide nurse that I told you all about before, she told me the trick was to put the lidocaine on there. And that lidocaine is a lifesaver. Although they spray that kind of like, it's almost like it freezes it. It doesn't, because one day I didn't do the lidocaine. Let me tell you, I hated it, okay? When I didn't do that lidocaine that day, I was acting a hot mess because I was really upset that I left the lidocaine home. But but I did. The lidocaine is a lifesaver, long story short. So the next medicine that I'm on is the Taxol. And according to my notebook here, which I actually, since I've started the Taxol, I haven't looked at this notebook, so you guys are making me look at it. But some of the side effects of the Taxol are low blood counts again, mild nausea and or vomiting, diarrhea, constipation or loss of appetite, muscle and joint pain, temporary hair loss, mouth sores, fingernail or toenail changes, discoloration or cracking, splitting, and numbness or tingling in your fingers or toes. I think I need to stop reading so fast. But some of the things that, and for my Taxol treatment that I'm receiving right now, I normally, that treatment lasts about 4 hours. Previously, the Adriamycin and Cytoxan, I was there for about 6. One day I was there about 7 or 8 hours. I was there for a long time. I had she wasn't able to get a blood return, so I ended up being there a little bit longer. But the Cytoxan Adriamycin is the longest treatment. I was there from anywhere from 6 to 7 hours. But with the new drug that I'm on, Taxol, I'm there about 4 hours every week to get this. About 4. Sometimes it's gone over 4, but it's around 4 hours. But some of the things that they kind of like tell you to prepare for when you are getting a treatment is just make sure you have proteins, fruit and vegetables. You could have mouth sores, and tell you that you could use biotin, it's biotin, salt and baking soda to rinse your mouth out. If you have 100.5 fever, or you need to call, or signs of infection, you need to call. If you have 3 to 4 loose stools a day, that's too many. You should take Imodium at that point. And you can exercise. Initially, I was able to exercise, and I may walk here and there, but I have not been consistent with exercising at all. And I know that the steroids have me, like, my face is, I can tell it in my face and my body as well, but I'm not concerned about losing weight until after I finish the chemo chemotherapy because they don't want you to gain weight, lose weight during this time, kind of like stay consistent to where you are. So that is kind of like my chemotherapy treatment plan. I can tell you that if I had to choose one or two, one of the drugs over the other, I would definitely choose the Taxol, because the Taxol is less, I feel like it's less wear and tear in your body. The Adriamycin and the Cytoxan, those are some strong drugs, really, really strong drugs. And some days you just like, Lord, why me? Why me, Lord? But you know what? There's a reason. And it may not be revealed to me yet, but I already know I'm healed and He has something greater for me.